Good morning, everyone. It's so wonderful to be together with you this morning as we gather together in God's presence to worship. We're looking at the topic overcoming family mental health challenges during and post-COVID pandemic lockdown. It's just a reflection of where things are in our world today. We are in unprecedented, uncertain times due to the pandemic, and it's having impact not just on the physical health but as well as on the mental health and mental well-being. And that's popular saying, which is there is more to good health than just a physically healthy body. In order to have a healthy mind, which is referring to our mental state and our mental health, you must be able to think clearly, able to solve various problems faced in life, be able to enjoy good relationships with family and friends and colleagues, and be able to feel spiritually at ease, and also to be able to bring happiness to others. Therefore, having a healthy body, a healthy mind equals to a happy life. And any illness that is experienced by a person which affects their emotions, their thoughts or behaviors, which is out of keeping with their cultural beliefs and personality, and is producing a negative effect on their lives or the lives of their families, is related to their mental health. In looking at this passage today, because of our time, we're just going to briefly look at aspects of mental health. We're going to look at a few specific strategies that might be able to help us to continue to maintain our health. And then after this, we will have a question and answer period by Zoom, which we'll be able to try and go down to a bit more specific. And to start off, I would like you, if you have your Bibles there, to open your Bibles with me to Matthew chapter 7, and let's read from verse 24 to verse 27. It says, "So everyone who hears this word of mine and acts upon them, obeying them, will be like a sensible, prudent, practical, wise man who built his house upon the rock, and the rain fell, and the floods came, and the winds blew and beat against that house, yet it did not fall, because it had been founded on the rock. And everyone who hears these words of mine and does not do them will be like a stupid, foolish man who built his house upon the sand, and the rain fell, and the floods came, and the winds blew and beat against that house, and it fell, and great and complete was the fall of it." I think one of the things that struck me as we looked at that passage is the same situation came upon both individuals. Everybody experienced the same difficulties. Everybody is going through the same experience. And if we look at the current pandemic situation, everybody is impacted by the pandemic situations. But the impact and the outcome of the situation on different people will be different depending on how well their foundation is laid, according to this passage of scriptures we read. So I guess the first thing to establish is that we are all going through these challenges. And everybody is impacted, not just in their physical health, but also in their mental health. So this challenge is common to everybody, but how we come out on the other side, or how well we're able to cope with it, will depend on the state of preparedness, will depend on our pre-morbid, what we refer to in medical terms as pre-morbid, which is having to do with what are the existing situations you're already facing before coming into this pandemic, and what are the specific situations that you are dealing with in this pandemic. In order to help us appreciate this approach, I would like us to consider how this whole pandemic has been dealt with from a physical health point of view, because we can draw parallels to the strategies that we have used in the physical health component to help us thinking about how we maintain a good mental health in this current pandemic. Now, in the physical health, the most important thing is they find out that the virus is passed from people to people, so it's important to keep that physical distance. There's promotion of personal hygiene to try and prevent the infection. There is a recognition of who are the people who are most at risk, and then specific strategies to try and protect them, and then to treat aggressively and timely anybody who is infected. This, if we put a parallel to that in terms of our mental state, I think we have to realize, where are we starting from? So are there specific people who are at an increased risk of mental health difficulties during this pandemic? Yes. If you've had pre-existing mental health conditions, for example, if you have somebody who, for example, has a history of obsessive compulsive disorder with germ phobias and obsessionality around that and cleanliness, you can understand that in this current context, that could lead to almost either a relapse or an increasing difficulties. So just as what they have done with those who have physical health, which is about introducing the concept of shielding, which is recognizing that specific people have a higher risk and therefore they need to be protected and kept secure and encouraged to pay more attention to the health. So I think the first group I would like to address is, if you know you already have some pre-existing mental health conditions, or you're struggling with anxiety or depression or any kind of mental health difficulties, I think this is a time when it's important to acknowledge, speak out, and let people around you know what you're struggling with and what you're dealing with. For example, you see, frontline staff, those who are under immunocompromised or who have, either they have chronic illnesses, or in the elderly, they say, no, we can't put you in the front line. We need to protect you, keep you away. So if you're really struggling already with severe, challenging mental health problems, you need to speak out. You need to let either your family members know, or your workplace, or whatever other interactions you have, so that people can support you, they can protect you, and they can be alongside you to make sure that you are protected as much as possible and that you're supported. So that's the first thing, and that's really important. I guess then the second thing is, as in the physical health, is the promotion of good physical hygiene. So we can draw the same parallel. If you don't want to get contaminated, if you want to keep yourself as healthy as possible, if we want to continue to maintain that healthy mind state, it's important that we need to establish some very good personal mental hygiene. And if you are someone who has never really paid attention to this in the past, or you've not paid more attention, then this is a good opportunity to actually think about it and thinking, okay, what's a good mental hygiene that I can develop or I can begin to participate that would be helpful. And some of these are very basic, which almost like the hand washing equivalent of mental health. And there are other bits which are a bit more sophisticated, which you can then get involved based on your interest. But I guess it's very important that we pay attention to our mental health. And some examples we can give with this is maintaining good early morning routine. So even just waking up in the morning with a sense of affirmation, gratitude, having that positivity to start off your day, it's a very good way to start your day and to keep that good positive outlook every day, irrespective of what the challenges and what you're going through. And I think at this point, a good analogy is to think of the pressure cooker analogy. When you have a pressure cooker, you have the heat generating the pressure there, and then you have a valve. And when you want to regulate the pressure within the pressure cooker, you usually, in the normal circumstances, you either reduce the heat or you adjust the valves in it. But if you have a situation where the heat is constant, almost as we have in this pandemic situation, and you have no control over a lot of the uncertainties around jobs, around future, around traveling, around the restriction in movement, and families being kept apart, children not being in school, people losing their jobs and stuck at home. These are things that you have really no control over. So I will equate that with like the heat there. But even though you have no control over this, there are other things that you have control over, especially your thought process and the things that you can do something about. And these are the equivalent of that pressure valve in that cooker. So don't just think because you've got no control over how this pandemic is affecting us, that means you have absolutely no. Focus more on the things that you have control over. What's happening with you, what you're thinking about, what you're focusing about, what are the interactions you're having with your family. So that sense of having a good routine, that sense of social connectedness with people. Yes, just as physical distancing helps you with the illness, social connectedness helps you with the mental component of the illness. So So some of the good mental hygiene that we can, so the first thing we've agreed is have a very good morning routine. Even sometimes, getting out of your PJ, dressing up, getting yourself ready, put on your makeup if you're a lady or a guy, you get dressed, get the children dressed, just getting a measure of normalcy back into your routine. And then have a structure to your day. If you have children, it'd be nice to have some plan. You can do this plan together with the children. So you plan your structure for the day. What is going to be study time? What is going to be play time? What time are they going to have for TV? So it gives a sense of a measure of control over actually what is happening with you and what is happening with you, rather than just being feeling that, you're just completely at a loss and you have absolutely no control. So when it comes to planning meal times, you can spend time with the children and plan the meals together. What are they going to do? Are they going to introduce them to new chores? It's opportunity to introduce them to different aspects. So taking some proactive action and putting a measure of control, structure, and routine into the way we function, it's a helpful way to feel a sense of control and a sense of containment of whatever is going on. The next important thing is to develop a good sleep hygiene. So even though we're in lockdown moment, it's still important to make sure that we're getting adequate sleep. If you have children, if they're not sleeping well, they will be irrational, they will be grumble, they will be grumpy, and they will be difficult. So it's important to make sure that they sleep well. So keep a good sleep routine, make sure that they're sleeping well. It's also important to focus on nutrition. Nutrition is important. Just as we know that with the physical health, if you're immunocompromised, the chances that you could get the illness or you could get a more severe form of the illness increases. It's the same way in our mental state. So some people might, get into the habit of overeating or undereating, and all of these things then have its own, further problems. So we need to keep an eye and make sure that we're eating elderly and we're keeping that going. We also need to keep physical exercise. So even though we're restricted and we're locked down, it's about thinking, how can we introduce movement into activities of our days? And we all have different exercise levels, but the most important thing is that you're doing something. We found out at home that lots of apps which shows how you can exercise without a gym, even walking around the house, walking even within a limited space, jogging on the spot. There's different things you can be doing. The other thing, one of the things that struck me, one of the things we miss about church is opportunity to get together, have a really vibrant time of praise and worship. And I found that even that whole dancing and movement actually has its positive aspect and it's part of our physical exercise. So you can put on the music, you can have a good dance and just feel free to interact with the children. Create an atmosphere of playfulness and enjoyment and fun, and make sure that it's not just things that are not just very serious or very serious focus. Find opportunities to do things that you all enjoy. Take some time to look after yourself emotionally, what we call self-love. There has to be a balance between work, between rest, between relaxation. And as part of that is about looking at things. What things do you enjoy? What things do you enjoy doing? Then get involved in all of those things. Do you enjoy reading? Do you enjoy listening to music, playing games together, watching movies? Whatever things that gives you a positive vibe, then we need to focus more and do a lot more around that. Meditation is a good thing, just living in that self-awareness of the present, because sometimes we can begin to worry so much about what the future holds or what's going to happen that we actually forget to live in the present, to savor the moment and to enjoy what's going on. That does not mean you're denying the challenges and the difficulty. It just means that you're taking a much more proactive, positive mental attitude to control what you can control and then leave things that you have no control over. That scripture says, sufficient for each day is the evil thereof. So don't worry about tomorrow, what tomorrow will bring. Let's live in the present. Let's pay attention to what we're thinking. Let's spend time to soak ourselves in God's word. Let's receive positive things from God's words to encourage and to encourage us. I guess the other thing is minimize your news feed, because sometimes focusing so much on information from the news and negativity can also affect you negatively or increase your anxiety and your difficulties. Maintain your social contact is so important. This is the time when you should give yourself permission to be able to pick up the phone call and just make that random, even when you've got nothing really important to say. Just connect with people. How are you? Where have you been? Because these are, in our normal days when we're out and about and interacting with people, we get the opportunities for all of these mundane conversations. But one of the problems with the pandemic is we're cut off from all of that at the moment, so we can't do that. So, feel free to pick out and don't feel that, I'm going to be disturbing people, because this is time to just reach out to each and one, and then lastly, let's just be compassionate and be helpful to others. And as we reach out to help other people, let's do it in an empathic way. Let's be patient with one another, and let's listen in a non-judgmental fashion. We trust God that in all of these things, God is going to keep us. We have the promise that God will keep us. But even in the midst of that, sometimes we do go through challenges. Peter says, count it all joy when you're going through diverse challenges and situations. Things can happen. Have had brethren who have either lost job or something, or lost someone. And that's an acute, really difficult trying moment that suddenly can generate a lot of emotional difficulties. So just as in physical health, where when you encourage people that if you notice that you catch the virus, don't be in denial. You need to reach out very quickly. If you know you are asymptomatic, they say, do self-management, self-isolate yourself, do all the positive things, eat well, rest well, make sure you're hydrated. It's the same way mentally. If, things begin to go out of hand, don't live in denial. Acknowledge it. This is the time when you should be able to acknowledge your feelings, talk to somebody about it, talk to your partner, this is where it's important to focus, to be mindful of our children as well. What's happening with our children? Do they feel disconnected from their friends? Even though, they might all be on social media, do they feel they've been left out? Is there any bullying or anything going on? Is there a change in their behavior? Are they not eating as well as they would do before? Let's look out for any reaction. Let's be very quick to recognize what the difficulties are and to do it. And then peradventure, you actually find out that it's not just a mild, you're actually having quite a severe reaction or an overwhelming challenge. Then it's the same thing, just as you will advise. If anybody is symptomatic with the COVID, you need to pick up your phone, you need to get in, you need to start treatment in time so that you can get the best outcome. If for whatever reason you're finding that actually you're not coping and you're really struggling and things are on top of you, please reach out and get help. If you need to go and see your doctor, if you need to get in contact with your spiritual counselors or people supporting you spiritually, whatever you need, please don't isolate and feel disconnected. Make sure you get the help. The earlier you start to deal with it, the better you're going to get on top of it, and hopefully you'll get a better outcome. And even as we see, even with the COVID, that for those who are even get the severe end of it, then there is a rallying round, So this is the time where, we need to get around to our brethren. We need to be praying for one another. We need to supporting one another. We need to be providing physical, financial, whatever it is that may be generating crisis for people, raising significant emotional difficulties. For a lot of couples, if you're really finding out you're struggling and there's conflict and you're not managing it, this is the time to dig into all those information about good conflict management. But most importantly, don't feel that you have to do this on your own. There is help out there. There is support out there. Reach out for friends, reach out for family, reach out for brethren in the church. Let's all come together and make sure that we are dealing and staying on top, and we're continuing to maintain this. So, in summary, as I round up, the whole issue, I like the topic which is overcoming family mental health difficulties. That means we recognize that it's going to be there. And like I said, this is common to everybody. We're all going to get this. And we're all going to get it at different times and in different severities. But the most important thing is, what do we do about it? So it's important, again, that we try and recognize where the problems are, focus on the problems, and then we'll try the best to be able to deal with it. Now, when we go to the specific question and answer period, I might be able to spend a bit more time and be able to answer some specific areas. But let's all recognize that because we are living in certain times, there is a lot of emotional unpleasantness that can come across our way. So remember that saying that you may never be able to prevent the bird from flying over your head, but you try your best to make sure it's definitely not putting its nest over you. So God bless you. I trust you've been able to pick up one or two things from this. I'll be glad to take questions and answers, or if you need to contact me, just feel free to do that. God bless you.